Do you ever notice a strange birthmark that looks like a coffee-colored splash on your skin? Or find that a child is growing taller or entering puberty much earlier than classmates? Those clues can point to McCune-Albright syndrome, MAS. It is a rare condition that mixes bone, skin, and hormone clues together, so spotting one sign often leads to checking the others. MAS isn't caught from a parent or an infection. It starts when a tiny change happens in a gene called QNS, while the baby is still forming in the womb. Think of it like a typo that appears only in some pages of a book, not the whole book. Because the mutation is mosaic, only parts of the body carry it, which is why the symptoms appear in patches, like the skin spots or bone problems in just one arm. What might you see? Bone, soft, fibrous tissue replaces normal bone, fibrous dysplasia. It can cause painless bumps or fractures, especially in the arms, legs, or face. Skin, large, irregular café olate spots with a jagged border, often described as the coast of Maine. Hormones, early puberty, especially in girls, extra hair, enlarged thyroid, or growth hormone excess. Imagine a child who suddenly grows a deep voice and hair on the chest, while also having a noticeable skin patch and a limp from a broken wrist. The mix of clues fits MAS. Doctors start with a careful history and a look over physical exam. Imaging shows the ground glass appearance of fibrous dysplasia in bone. Skin exam confirms the characteristic café olate spots. Blood tests check hormone levels, thyroid, estrogen, growth hormone. Genetic test can find the GNAS mutation, but it is not always needed if the clinical picture is clear. Treatment is not a cure, it focuses on each problem. Orthopedic surgery, or braces for bone lesions. Hormone-blocking medicines, for example aromatase inhibitors for early puberty. Regular monitoring to catch new issues early. Because MAS comes from a random mutation that happens before birth, there is no way to prevent it before a child is born. However, early recognition helps families plan care and avoid complications. Keeping an eye on growth patterns, skin changes, and any unusual hormone symptoms can lead to quicker treatment and a better quality of life. Researchers are exploring ways to calm the overactive GNAS pathway. MEK inhibitors, drugs used in some cancers, have shown promise in shrinking bone lesions in pilot studies. Scientists are testing gene editing tools like CRISPR in cell models to correct the GNAS mutation, though this is still early stage. Ongoing registries collect data from patients worldwide to better understand which treatments work best for each symptom. These advances mean that, while we still cannot erase MAS, we are getting smarter at managing its effects.